Hello, friends. Welcome to lab. Okay. So here's the plan for the next 2 weeks. It's a big time right now. Take it, enjoy it, see what you're doing. Grades have been like pretty good so far, so I don't think anybody's like completely bombed it. Um, so um, this week we're gonna go over respiratory. Today we're gonna do gross anatomy, histology on Thursday. We'll do digestive next week. And since there's no like metabolism stuff for like lab, like there's nothing to go over for metabolism for lab, so we'll just kind of like catch up, and then we'll start module 4 at the same time for all that stuff. So you'll have this test, you'll have next week, you'll have a lecture test the next week, and then you'll have module 4 stuff start next week. Okay, so hopefully, kind of like makes a little more sense. Also, I reserve the right to throw all things out the window. So I'll try not to though. But for this week and next week, we're going to do gross anatomy, histology. Okay. So I know that the top hat for the respiratory stuff was like already like dead and gone, but since we didn't actually cover it, like lecture-ish thing, I think we should probably do that. So, all right, let me show you the respiratory system. Okay. All right, so this is the body, the human body. Let's start there. All right, the respiratory system. There we go. All right, so let's peel that back. And I'm even going to dial it back a little bit more. Okay, let's go here. All right, so we're going to start pretty much where it goes in, like where the air comes in. All right, so the upper respiratory tract. So we start with the external nares. So you can peel back. Okay. So this is the external nares. Let's dial it in. Right, we've got external nares right here. I'll peel that back. Okay. Those are your nostrils, basically. External nares. They're holes in your nose. Okay. And then from there, air moves into your nasal cavity. So that's this whole area right here. And then we've got some bones there too. So see if we can do this. Here we go. All right, so we've got this bone right here in the middle. This is the nasal septum, and as you can see, it's not like your nose, right? Like it's within your nose. Okay. So that is your nasal septum. And then above that is this part right here. This is called the perpendicular plate right here. Okay. So we're just looking at skull anatomy for this stuff so far. And then we have the vomer bone, which is down here. So you have the septum is the whole thing, the plate is this part, and the vomer is this part. Okay. Now, air goes in and it comes through your internal nares. Your internal nares. Your internal nares are at the back of your nasal cavity. Okay. Right there. So air goes through all that, goes through your turbinates and your concave. So you've got these nasal concave, and then I've got this off the side. I'm kind of teaching off of it, but it's a little bit easier to see the zygote body. So this is like a mid-sagittal section of the head. you have these weird labyrinth looking things. So you have a middle, a superior, and an inferior bony structure, and those are called concave. Okay, and those are for rapid warming and filtering. So you're increasing the surface area, basically. All right. Then you've got some paranasal sinuses. Let's see those. Okay, so within your skull, bring this picture over again. Right here, this is called the ethmoid bone. Okay, and this bone is, remember from the olfactory stuff that we talked about, this is where the olfactory bulbs come through the ethmoid. Okay, so right there. Right, and then within that, there are some air spaces. So they're actually lined by like nasal tissue, right? So like the same epithelial tissue. And they do like kind of inflate and deflate, and they look like that. These are the ethmoid air cells. Okay, those are your paranasal sinuses. And then you also have frontal air cells too. So you're within your frontal bone. That's not too helpful. Yeah, these are your frontal sinuses right here. So they sit within your frontal bone. So right here, your forehead, not like your whole forehead, but some of it. Okay, and then this is full of an air cell too. Okay, it's right there. And it's like kind of big. So you can see when like you have like sinus pressure and like it's here, it's like a big space that's being filled up. Okay. Right, and then you also have a maxillary sinus, which is here. And that is in your maxilla, right? So this is your mandible down here. This is your maxilla. And that is where your maxillary sinus is. So again, kind of cross-sectioning through the head. It's right here above your jaw. Okay. This is where like sometimes you have a sinus headache, you can kind of feel it in your teeth. Like it's all kind of right there. Right? And then your sphenoid is right next to your ethmoid. So this is your ethmoid air cells right here. This is your sphenoid sinus. And it's in the very, very back. Okay. You can kind of see that. And you can see it here. So ethmoid is here, sphenoid is here. Okay. All right. Any questions about your skull and your bones? Okay. No, let's move on. All right. So, somebody got a question? Nope. Oh, Larry speaks for everybody. Okay. Shouldn't. All right. So, you've got all of this space divides. If I can see it. Probably notice. Straight somewhere again. All right. So, if you have this cross section of the head again, you have a palate. Okay. So the palate. Think like Palatine, Latin, like Rome, like they have like the Palatine Senate kind of thing. Uh, that is what this is named after. It's a big like round space. Okay, so you have a palate. So you have your soft palate and your hard palate. So we'll start with hard palate. That's where this bony structure is, and then that kind of transitions into a soft palate. So this does not move. This is hard. This is soft, and it does move and shift. Okay. Right, pharynx. Right, so you have your pharynx, and that is at the end of the soft palate. So you can kind of see it moving back here. Now you have your nasopharynx, which is up here, your oropharynx, which is what they've highlighted, and your laryngopharynx, which is down at the bottom of it. Okay. So there's three spots in your pharynx. So upper, middle, and lower. So nasal, oro, laryngopharynx. Okay. The reason we call it the laryngopharynx is because it is right next to the larynx, right? So let's back a little bit. Right, so the larynx is your voice box, right? And within that, there's a couple like cartilaginous structures. There's bones. There's like a whole bunch of stuff going on here. And this is where the air is passing through. So it goes in your pharynx and through your larynx. It does not follow your pharynx into your esophagus. It goes into your larynx. Okay. So let's talk about your larynx. So this is a very top structure right here. Oh, go. This right here. That is your epiglottis, and it is just a covering that flaps down over the top of your larynx. Okay. Now, this is important because it keeps food from getting down into your lungs, which is bad. You'll die. Okay. All right. And then we have a couple cartilages around that. So we've got your let's see, isolate. No. All right, so I'll show you these little model things. Okay, so we've got a thyroid cartilage, that's your Adam's apple right here. Right? And then you've got arytenoid cartilages. So if your thyroid is on your anterior side, and this is thyroid right here, your posterior side is your arytenoid cartilages. Okay? And those are these big horn-shaped looking things, right, on the posterior side. Now, those terminate in the corniculate cartilage. Okay, so there's thyroid cartilage, arytenoid cartilage, corniculate cartilage. There's a couple more, but that's kind of the main ones for that area. Okay, and then you've also got your cricoid cartilage, so that's right below your thyroid cartilage, and the muscles right here. So, like, if this is thyroid cricoid muscle, like, so it's attached to both, right? That happens a lot in this area, okay? Your vocal cords. So you've got true and false vocal cords. You've got like an opening and then a layer of tissue that goes over the opening. That's basically the difference between the true and the false. The false ones are the outside, the true are on the inside, okay? Right, and they literally look like cords, like this. Okay? So if this is the glottis, this will open. All right. Any questions about the upper respiratory tract? Anybody want me to zoom in on anything? Pretty good so far. All right. Let's talk about the lower respiratory tract. So from there, air moves into your trachea, right? Okay, so your trachea is this big cartilaginous tube. It's got rings. It holds itself open, which is awesome because we're just breathing air. Okay. And then, geez, your trachea. Hang on. Sorry. It's so frustrating. I want to use complete anatomy, but it's locked out of it right now. Okay, so your trachea comes all the way down into your chest, and then from there you've got two divisions. What are those called? Those are your bronchuses. Good job. Okay, so you've got a right and a left bronchus. So right goes to the right side, left goes to the left side. And then you've got that middle section that divides it. This right here, that's called the carina. Okay, so the crown of the trachea. Okay, cool. Okay, and then that will subdivide into the respiratory tree. So you can kind of see right here, you've got 1, 2, 3, 4, 5, 6, 7. And all of these are primary bronchus, secondary bronchus, tertiary bronchus. And then from there, we're going to subdivide out into bronchioles. So anything smaller than a tertiary bronchus is a bronchiole. Okay. And there are 20 tertiary bronchuses. Okay. All right. All right. Okay. This we're getting too small now for zygomatic stuff. I'm gonna go off this little slide now. Okay. So at the terminal bronchiole, we have these little bundles right here. Okay. These are called respiratory bronchioles, and this is where respiration happens. So gas exchange happens in this spot. Okay. And then we have the alveolar duct. So this little hole right there, that's where the alveol that goes into the alveoli. And then we have individual alveolar sacs from there. So all these little blue things right here. The inside of it is the alveolar sac. Okay. And then individual blebs, I guess you could call them, these little circles, these are individual alveolus or alveoli. Okay. One alveolus, multiple alveoli. Okay. And then between that, you have a capillary bed. Okay. So it kind of looks like this. You've got the capillaries embedded all throughout. And that goes all the way down to a single, the diameter large enough for a single blood cell to pass through. So we're going really small right here. And the reason for that is the direct gas exchange that happens in the capillaries. Okay. All right, lungs. I'm like 100% certain I can do this. All right, your lungs. Your lungs. You've got two of them. You've got a right one and a left one, which is awesome for you. All right, you've got lobes in each one. So on the right side, we have how many lobes? 3. Yes. And on the left side, we've got, thank you, Arm. We've got 2 lobes, okay, on the left side. Now, that doesn't mean the right one's bigger than the left one. I mean, it kind of is, but only by a very tiny amount. But the reason for that is because we have a heart right here, which is also like super duper important. Okay. So we divide into 3 lobes on the right side and 2 lobes on the left side. Extra credit. What are those lobes called? No extra credit for you. We have a superior, middle, and inferior lobe. And they are divided by the horizontal fissure here on the right and the oblique fissure on the left. Okay. There's also an oblique fissure over here on the right. So if I ask you a test question, which lobe or which lung has a horizontal fissure, it would be the right one only. Okay. The left one does not. Cool. Cool. All right. Respiratory muscles. Let's talk about inspiratory muscles. Okay. Inspiratory. However you want to say it. All right. Breathing is driven by the diaphragm, largely. Okay. So this is this big parachute-looking muscle right here. It creates a vacuum on your thoracic cavity, which inflates your lungs, right? And then from there, other little muscles take effect. Okay, so you also have your external intercostals, mostly intercostals. Well, that didn't work. Okay, so you've got external intercostals. I'll drag this over. All right, so you've got your external intercostals. So those are your most external muscles between your ribs. Okay, and then you've got your sternocleidomastoid. That's the one where you can kind of feel it right here. This one right here. Okay, and that one elevates your rib cage. And then pec minor also elevates your rib cage. So think like move it backwards, you're pulling your rib cage up. And then your scalenes, which are in your neck. Okay, so those also are a little attached. Okay. Expiratory muscles, you have your internal intercostals. Now look at this, external intercostals, internal intercostals. They are moving in opposite directions because they have opposite functions. Okay. Expiration is mostly driven by just releasing your diaphragm. Okay. So when you're contracting your diaphragm, you're relaxing your diaphragm. Okay. Like most of breathing happens there. Okay. Forced expiration, also you're employing your rectus abdominis. So like you feel your abdomen kind of tense when you do that. And then your external obliques as well. So you're tensing your abdomen while you're doing that. Okay. Your internal obliques are also getting a little involved. So internal, and then your externals, and then your rectus abdominis are all those muscles. Okay. Transverse abdominis kind of squeezes the abdomen, makes that area smaller. And that's all your muscles. That's all the muscles. This is this PowerPoint is on the lab images and models. So you're gonna want to look through this. Okay. And learn all these. All right. Pleura. So you've got parietal pleura. That is the lining that surrounds the lungs. So this right here, this is a cross section, maybe like a CT scan of you can see the lungs and you can see the heart. So right here, you can tell this is the left lung. This is the way it is, and this is the right lung. Because you have a fissure right here, which is your horizontal fissure. Well, actually, that's a blue picture. But you've got lower and middle lobe right here, and then just a lower lobe right there. And then your heart right here. And then all of this part is surrounded by your parietal pleura. Okay. This is not parietal pleura. What is this part right here? Pericardium. That's correct. Way to go, everybody. Okay. So you have your outer parietal pleura is the membrane of the outer membrane, and then it touches the ribs, and then the visceral pleura is what touches the lungs. Okay, visceral pleura. Cool. So just like you have parietal pericardium and visceral pericardium, same thing. Different layers, but same thing. They cover the lungs, and it's literally like cellophane. Like it's like very sticky and really hard to dissect off. So, all right, and then the space between that is called the pleural cavity. Okay, so cavity is just the absence of something. So there's fluid kind of between that. If there's supposed to be too much fluid, could be a pleural effusion. Cool. That's all I got for gross anatomy. I don't want to rush this, so I'm gonna keep these like relatively short, and we'll get into histology on Thursday. And you guys are more than welcome to study these at your own pace. Make sure you're doing your pre-labs and post-labs, and brace for them to be under fire. Okay. So, any questions about gross anatomy of the lungs? Negative. Awesome. Cool. Hey, since we're like actually aim at the exception, like stop recording.